Basically, we can practice by firstly being human ourselves and being open to being an active listener to friends and family who might be in distress during this period of time. So what you can do is be an outlet for them to vent, their challenges, their struggles. And also we can encourage those around us by validating their experiences, what they are going through, the real sort of aspects of the challenges that they are going through, and also offer them words of encouragement and support as well. So those are the ways that we can actually be really present and supportive towards others around us. For the youth in Singapore or as students as well, you can play a major role in advocacy for mental health awareness and also acceptance of others with mental health conditions as part of the society as well. There are various actually services right now in Singapore for mental health. There are actually direct service providers like the Institute of Mental Health and other hospitals that offer psychiatric services, such as the psychiatrists, the psychologists, the counsellors, as well as case management services as well that they provide. There are also various social service agencies, to name a couple like Singapore Association for Mental Health, the Singapore Anglican Community Care Services, Club Hill, Silver Ribbon, and so on. So there's quite a number of these sort of services that provide recovery and rehabilitation services, such as peer support, counseling, skills training, job training, and matching services as well. So some of the challenges are also financial in nature. So sometimes a caregiver has to actually give up their employment to actually take care of their loved one full time. So that loss of income is also quite a big issue for the caregivers in terms of the strain of having to pay for medication, especially non-standard medication, which can be expensive. And there's not as much MediSave coverage as yet. And there's also not as much medical insurance coverage nowadays for mental health related conditions. So that is also an issue. They also face sort of social sort of issues as well, because they are having difficulty in terms of connecting to people around them, or they might face a lot of self-stigma about people judging their loved ones having a mental health condition. So they tend to maybe isolate themselves and not really having a lot of social support systems to go to. And emotionally, they also might be going through burnout at times, because it's a very heavy load to carry over a long term, or caring for someone with a mental health condition. So sometimes those are the kind of issues that they also go through, and may also challenges that they might be facing along the way. Definitely, there's a lot of power in care. I think it's how you define care. I think care in terms of empathy, connecting with another individual, showing that understanding and willingness to have that unconditional support can make a huge difference for a person with a mental health condition. And I think also especially for their caregivers as well, because they will feel that they are not being isolated, they are actually being supported and wrapped around with support in that way. And I think by actually being present, practicing active listening, these are skill sets of care as well that can be a very vital part in actually showing people that they are accepted members of society, and that there are other people who actually know that they play an important role as who they are as well. I just want to encourage any persons with mental health conditions out there that you're not alone in this. I'm also a person in recovery myself, besides being a professional. So I know what the challenge is like of going through a mental health condition. And there are a lot of people who are rallying around you, and know that there are people who do accept you as who you are as a person. And to all the caregivers out there, I know it's an arduous journey, but I think you are doing the best that you can. And also please be kind to yourself, and know that you're doing the best by your loved ones or your friends that you're supporting. Just know that they really do appreciate your care and concern, even though they may not always express it at the moment. So do know that you're also providing a wonderful sort of, more than a service, I would say. You're doing a wonderful thing to support loved ones with such a condition. So do journey on with them, and know that the fight continues and things will get better in time. Okay.